The University Health Network opened vaccine pre-registration for those 18 plus in 3 Toronto hotspot postal codes on April 12th, M5V, M6E and M6H. Over 20,000 people signed up and the registry was closed the next day due to lack of vaccines. But over the past week, some who managed to get on the list have been receiving vaccine invites, not from UHN, but rather from the province, leaving many others wondering why they weren't chosen.
You go through and refresh your email. Well, I do almost every half an hour. So you're kind of on pins and needles as to when you're going to get that notification.
Anthony is an essential worker living in the M5V area and says he's seen people from his postal code talking about their vaccine appointments online, even though they're working from home.
I work in the construction industry. I'm actually not on site, but in office and required to go to site when needed. So it's not really an option for me to work at home.
Which begs the question, who is being prioritized to get vaccine invites? UHN tells us that they had to move 8,000 people to the provincial system after being inundated with pre-registrations. Those 8,000 were chosen first from their pre-existing registry of people who are both at higher risk and live in the 3 identified postal codes, and then by random selection from the postal codes alone. That list was sent to the province and they are sending out the vaccine invites.
Everybody in the line here.
We reached out to the province about who is being chosen to get the invites and why, but did not hear back by airtime. But even those lucky enough to get an invite say it's not all smooth sailing from there.
When my wife and I went to to book the appointments, we couldn't find a single available date in any Toronto location.
It's a complaint we've heard from several people across social media.
I couldn't understand why they'd sent me an invitation to book if there were no spots available. You do have to keep refreshing it over and over again, and you have to book far away from you.
Many have only been able to book in Etobicoke or Mississauga, making it necessary to commute to an appointment. Not convenient if you don't drive.
It's not a great option to have to ride in an Uber for half an hour to get there. It makes me a lot more comfortable than riding the TTC all the way out there.
But we know that a lot of people in these hotspot areas may not have access to a vehicle, may not have a credit card, may not be able to afford to travel.
And if they do manage to get there, some are reporting that they're being turned away from clinics in Peel because they do not meet the eligibility criteria.
Then they would have to ask to speak with a manager, show them the initial invitation email and the confirmation email in order to get the vaccine.
But the official word from Peel Public Health is that only the following groups are being vaccinated at their clinics. All residents 60 and older, those 50 to 59 in hotspots, education workers living or working in hotspots, and special education workers.
So I'm bracing myself for that experience, hoping that there's not a roadblock there. I just want to get my vaccine and get it over with.
Now, the 3 postal codes M5V, M6E and M6H are supposed to be served by mobile and pop-up vaccine clinics, but there's been no word on that for these areas just yet. To find out where pop-up clinics are operating in the city, you can go to our website, citynews.ca. Point your phone camera to the code on the screen and follow the link that pops up. For City News, I'm Dilshad Burman.